Okay, good evening, everybody. I want to say thank you for attending the webinar tonight. Today we have a special guest all the way from Shanghai. He is Malaysian, though, not Chinese. And he is here today to share about his experience about changing careers from a doctor to hospital administrator and then to now related to health insurance. So Dr. Ebner will be discussing a few points that we have already pre-planned, but of course, when you have questions as well, you can just shoot your question either in the chat, and I know some of you are very, very brave and you can just unmute and ask the question as well. Yeah. So before we start, let me ask you a question. As always, I'm going to have a poll. Alamak, my poll hilang pula. Wait, wait. Poll. There you go. Alamak. Alamak, my poll hilang
There's
pula.
16 of us now.
So I actually have a poll, but my poll didn't save properly. So I'll just ask you and you can type your answer in the chat, yeah? So how many of you are currently thinking about changing career? Yeah. So are you thinking about changing career? Is it yes, no, maybe, or depends whether my boss is in this webinar tonight, what your answer is. So you can put that in the chat and let me have a look what your answers might be.
This is a very interesting topic.
Yeah, so
a very good question.
Oh, yes, definitely. Wow, yes. Rather, of course, my boss is here, so the answer is no. That's quite a good one, actually. And the rest, quite a few of you are yes, and some are thinking of staying in the same field, so copy still in pharma. Okay, awesome. Thank you very much for your answer. So let me share my screen. Okay, can you see my presentation? Yes, no? Ebner?
Belum lagi.
Belum lagi?
No. Belum lagi. Okay.
Okay, now? Yes, good.
Yes.
Yes. Okay,
Yep.
awesome. So a little bit introduction about myself. Some of you might know me already. I am a medical doctor, so similar to Dr. Ebner. I was a nephrologist before when I did my clinical training. I then moved to pharmaceutical industry almost 20 years ago, and I have international experience. I work in England, in Germany, and in the US before I came back to Malaysia 5 years ago. And now, on top of my normal work, I'm also interested in helping people climbing up the career ladder. And so I've started this webinar series quite a while back already. This is episode number 12. And throughout all these 11 episodes, we've been covering this different aspect about what you need to focus on when you're thinking about your new career. When you're thinking about jumping career, what do you need to focus on? So your CV, these days, your LinkedIn page is important. Obviously, you have to brush up your interview skill, your presentation skill, and your work performance need to be tip-top. And I hope you already work on your image and personal branding. And then you also have to be working on your you have to be making sure that you network internally and externally. So all these have been covered before. And if you're interested to watch them, that's the QR code for my YouTube. You can just scan that and you can have a look at the YouTube page and watch them at your leisure if you missed the webinars before. So today, all these are basically coming to a climax, if you want to say that, because you've heard about all this theory, but now you have somebody who has done it. So Dr. Ebner is someone who has changed a career a few times, and what better than to ask somebody who's done it about what did he learn along the way. And with that, I pass to Dr. Ebner to introduce himself and to let us know about what exactly has he been doing in the last few years. Over to you, Ebner.
All right, thank you. All right, thank you, Dr. Azza. Thanks for everyone for coming to this webinar, and also the host, he actually, we had a casual meetup once in Malaysia in KL, and then he was casually asking. I said, okay, give it a try. So this is my first time doing this kind of, this kind of short courses or talk something regarding career. Usually I'm giving talk more on the on the business aspect and on the company aspect. So yeah, without further ado, maybe I just do a quick introduction about myself. I graduated from UM and as a doctor, and I did my housemanship in HKL. And throughout that journey, I when I move on to clinical practice, actually had a lot of this first-hand experience with patients, and I actually enjoyed the process. But enjoy talking to patients and even shared their their experiences with me. And I think that talking to patients and having their experiences, I think is very valuable, simply because if you were to think it deep enough, actually as a doctor we have the privilege not just to cure or to treat patient, but we have the this what you call that as a travel time, whereby you can actually look ahead of time, because through people's experience. If you were to understand, sometimes they give you a glimpse of what will be the future, or what the rest of the people have gone through, the perspective of life, and what do you expect, in different phases of life. So that actually helps me to think a bit deeper on the whole perspective on what do I want in the years to come, you see. So that actually helps me a lot, especially if you ask me when do I enjoy talking to patient the most, is that during midnight on call, and some weekends and all. So if you really spend some time with your patient to know them better, you actually you really enjoy talking to them. And one of the experience I had is that I even had a stage 4 testicular cancer that complains with lower back pain and all. He was a very lonely guy, but he's an artist, you see. So at that point, he actually, I spoke to him deep enough, he wanted to even draw a portrait of me and all, in the ward and all, but I was just too afraid. And looking back, two weeks after I spoke to him, he actually passed on. So that actually gave me a bit of, a reflection. What was in my head is that time is that I was just too scared to look back. But if right now, if you ask me, those actually creates a lot of good memories and very memorable part of our life, you see. So then, as I move on as a medical doctor, and then completed my compulsory service and all, then I actually asked myself, what should I do? Should I be a specialist? Is that that's a very typical road. And many of my UM batchmate actually moved to Singapore, because Singapore do recognize medical degree, and I think about 30 to 40% of them are actually in Singapore, unfortunately. So Malaysians are creating doctors for Singapore healthcare system, unfortunately. Yeah.
And
Then
nurses.
and nurses, yes, precisely. And I saw one of the news is that now the government is opening up temporary license for nursing. A few weeks ago, I was with the one of the very key senior leader from one of the private hospital, which I shall not name. He was sharing with me that they have oversupply of patient now, and the reason that they cannot open up more beds is because they have not enough registered nurses. So this is actually a very key challenge that the current environment in Malaysia. And I think that the salary does play a role as well. Well, I shall not go into that. So then after that, I was at that time, that was about 10 over years ago, about 10 years ago, when Malaysia opening up the medical school to train more doctors because of a severe shortage of doctors. So when I saw that policy coming in, I said, oh, this will not be good, because with the very limited career opportunity to be a specialist and all, with all this medical school opening up, we would expect a huge number of medical graduate in the next 5 years. When I saw that coming, then I thought, it would be good if I would to look into something else. And that was actually a turning point for me, that I look into something non-clinical. Yeah. So if you were to ask me when I decided to leave clinical, and how do you know if you are ready to change my career, right? So at that time, I think for
Yeah,
any turning
maybe
point.
before we go to that, Abner,
Oh, sorry.
maybe we can go to the how did you decide which area would be for you? Because there are many questions that some of the doctors in here, those who are thinking about leaving the government work, quite a few of them come to me
Mm,
and ask what can I do? Even in pharma, they will be asking, what can I do in pharmaceutical industry? Because they don't really
mm,
know what it is, and they don't really know
mm,
what their strength is. And then, of course, about the other area of healthcare, like administrative, hospital admin, like what you did before, and then GP and
mm.
other aspect of healthcare. Many of them have no experience, and therefore finding it hard to even decide what they think might be suitable for them. So what was your process when you were thinking which industry that you want to go in when you already decide you wanted to leave?
Yeah, honestly speaking,
Yeah.
now if you were to look back, yeah, it was actually a very tough question. Even myself was quite lost. Honestly speaking, I was quite lost at that time. I wanted to move out from the Ministry of Health, but at the same time, I have a deep down in my heart, there's a fear of unstable job, because if once you move out from the Ministry of Health, basically you are in the open market, whereby when once you're in the open market, job opportunity is very competitive. You need to be good, and to compete with the rest. There is no room for mediocrity. That's my principle. You need to be good. So I think first of all, you need to know yourself, and you know what you are good at. And but I think the other point is that you need to talk to people. You need to talk to expert, in different medically related industry. And then once you decided, give it a try. Go for a one or two interview with different field, and get a feel of what they would expect, or the job description that they would expect you to do. You know, so I actually tried interview with some pharmaceutical companies and all, and actually even with medical devices company. So the first impression that I had was that, this field isn't for me, because I really don't see myself as a MSL, and or something similar. At least at that point, that was the job opening that they have for me. So seeing myself as MSL is like, it's just not my cup of tea. So at that
Mhm.
time, thankfully there was a good window period. I was in one of the private hospital, and I bumped into the managing director, and I actually spoke to him in person, while waiting for a lift to his office.
Oh.
So yeah, it was very lucky, and I spoke to him. I said, Mr. So and so, I said, I'm actually looking out to try the non-clinical. I said, I'm a doctor here, at that time, I just moved on to the private side. So then he asked me, do you have any experience? I said, no, I don't. Then he said, then why do you want to move out? I said, I wanted to try something different, and I think I have a passion in it. So then he said, but if you don't have experience, how do you have that passion? He asked me. Then, I replied to him, I still remember. My answer to him was that I said, if it's not here, where? If it's not now, when? I said, I'm the doctor here. So I said, I know the system, I know the doctors and I know the nurses, I know some of the the workflow in this hospital. So I said, this is the best place for me to transform into something different. So then he was taken aback and then he said, okay. So then because it was in the lift, right? So he went up. It was very short, less than 3 minutes conversation. So,
That's a long lift.
unexpectedly, yeah,
3 minutes is
I mean,
very
while
long.
waiting,
Oh, while waiting as
while
well. Okay,
waiting for
okay.
yeah. So, and then to his office. So I sent him off to his office, you see. So,
Uh-huh.
then surprisingly, 2 weeks later, he actually called me, he called me for an interview
Wow. I love that story
for a non,
because I tell people that you need to get your elevator pitch ready, and your story is why you need to get your elevator pitch ready, because you never know who
oh,
you're gonna
yes,
meet, right?
yes, yes.
Yeah, because
I never thought
exactly,
of that.
it
I
really
never
is.
thought
So
of that.
your
That
your
was
three
like
minutes is the start of a whole new life, not even just a bit of a
precisely.
career. It's your new life started by that 3 minute elevator conversation. Incredible.
Yes, now looking back, it's really valuable, and and he opened the door for me, and I came in. Well, when I
Yeah.
took that opportunity, there is some drawback as well. I got to take some pay cuts, and then I got to adapt to different environment, and yeah. So I think the most difficult part is the pay cut. I took a steep pay cut. If you were to measure it, is I took a 50%, close to 50% pay cut. It
Wow,
was quite steep.
50%.
Yeah,
Were you married at that time
yeah.
or single?
I was married,
Married
so I told my
already.
wife. I told yes. Then I told my wife. My wife said, "Well, you treat it as as a tuition fee." I say, "Okay."
That's
But it was a steep
excellent.
pay cut.
Yeah, for you to have
So
such a supportive wife is incredible.
yeah, actually, she did help me a lot in supporting me all the way, even right now, which
Uh-huh.
I will share a bit more. Very, very interesting story how I switched my career, at different level, even different organization, there always a turning point, so I will share deep into it a bit later. But that was about 10 years ago, yeah. And so the first thing
10
they told
years.
me is that, say you he said you have no experience, we can't pay you high, and you got to start from the bottom. I said, okay. I said, let's do it then. So so
Yeah.
that was how I started my career in a non-clinical, and to be honest, I had a lot to learn. I don't even know how to prepare a PowerPoint presentation. Seriously, no
You don't
joke.
have to do that in KKM, right? KKM another PowerPoint at that time.
Yeah, at that time, no. My PowerPoint was just words and a blank white piece of blank background.
Yeah.
So it was quite tough. So then thankfully I met with a few good intern. They are from Ivy League University and all. So they actually helped me out with how to write a PowerPoint. They give me some guidance here and there.
Mhm.
But they are much younger, so I took their advice, I read, practice, macam tu lah.
Mhm. Yeah,
Mm,
I think for me, the gist that I get from your story is, although you don't have the experience, you have the passion, as you mentioned. And
yes.
when
Yep.
you're thinking about a new career, as you're looking around, as Amna said, basically ask people what does the actual 9 to 5
Yeah.
work is like. Then you get a better idea of what the new career is. If you're thinking about jumping to pharmaceutical, you can talk to MSL, medical advisors, or the RA or PV, and find out
Yep.
what exactly do they do. And if it if it's connecting with you, then maybe it is for you. If you, when you listen to it and you think that's not for me, like Abner said, MSL and all that, not for him, then it's not for you. And the only way to know is really talking to people. And when I decided to leave medicine, clinical medicine, I was thinking about insurance, and then I was thinking about pharmaceutical because I wanted to continue my research. I was doing some research during the clinical part. It was more
Okay.
epidemiology, real world stuff. And then when it comes to, and then I wanted to continue. And that's why I look into more pharmaceutical area. And my friend was already in the pharmaceutical industry. And that's why, and she said, you should come, it's fun. And that's why I gave it a try. And again, you need somebody to give you the break because I also had no
Yeah.
experience when I first moved pharmaceutical industry. And I was very fortunate that the first interview, I got the job already, actually. And again, I'm
So you
very
still enjoy?
thankful. Oh, definitely. 20 years already in pharmaceutical industry. Yeah, really. But and again, I'm very thankful to that very first boss who gave me the job for
Yep.
trusting
Yep.
me to someone
Yep.
with no experience, just bringing my passion over to him. And he
Yeah.
saw whatever that he saw and gave me the job. Same to you, right, Abner? Whatever that he saw,
Yeah.
we are thankful for these bosses for giving us the break. And if you are not successful in your
Yeah.
first, second, third attempt to move into another industry, keep trying because you never know who is the person that's going to give you the break when you don't have the experience. You need that lucky break. Unfortunately, you still have to wait for that.
Correct.
Okay. So the
Yep.
next
Yep.
question that we prepare is a lot of people are scared about moving. So how did you know that you were ready to jump career, jump ship? So you've changed career, you've changed company a few times. And how do you know that the time is right? The time is
Okay, by the way.
now.
Okay. Let me do a disclaimer. I do change a few companies, but with good reasons. And I stayed on the companies for quite a while before I change.
It's normal.
So
Yeah.
yeah, so I think three considerations that I always ask, even right now, even if my staff were to leave, resign, or if they sometimes they ask me that, should I move on to another department, to learn things and all. So I always ask them these three very key considerations. I said number one, think about the salary. So I said salary is the first point. Second is the career progression. So, career progression in terms of, are you ready for, or do you want to move on to a larger opportunity or newer platform? What is your aim, in the next 2 or 3 years or 5 years? So what do you want in the future? So I think this is the second question. I said you got to think about it. And number three is the resources. That will include your networking, or not just networking, but if let's say they're able to increase your resources, from knowledge, from networking or whatsoever, I think that is also valuable. So I said based on these three category, score, put the points. If out of 10 points, put on the weightage, which basket is your main primary decision maker, or the heaviest consideration that you put into. So I said, once you have decided this, then you see out of these three, make sure that the top two, once it fulfills the top two, then you got to think about this job, the job opportunity, or if you were to move on, does it fulfill what you wanted? If salary is your key point, then fine, you can go to a private hospital, for example. Or if let's say like for example, that time, when I took a change, salary wasn't my main concern because I wanted to learn. I need resources, I need to network. And the second part, I need a career progression. And that's why, salary cut about 50%, I can still accept it. And for that reason, I think I'm ready for this job and I move on. So and I think the other issue is that if you want to move on to a different industry altogether, first of all, I think you got to do some research. in this industry? Is, do you believe that this industry going to move ahead of time, or there are still a lot of rooms for improvement, or the future is still very bright or not? Because sometimes decisions are made based on multiple consideration, but the only limitation that you have here is your domain knowledge. If it's beyond your domain knowledge, you would not know whether this is right for you or not. Then if that's the case, then you need to talk to people more, in that industry or the specialty. So I think once you talk to a couple of these people, and then with the few consideration that you put into place, and then I suppose that you will know that, you will be ready or not. I mean, that's for me. How would I really gauge whether would I move on from one company to another company, or if I were to change the industry. Yeah.
Yeah, I would agree with that. I am less analytical than you. I think I've realized you are more analytical than me from our conversation in the last couple of weeks. But in terms of looking at the factors, similar. I don't really give scoring as detailed as that. But very similar in terms
uh,
of, yeah, what is salary, what is the career progression, and what is the resources. Probably for me, the salary not so high up, more about the career progression. What can the new role, new industry, what can they offer in terms of the longer term? Because what do I want to say? The salary is usually the short term, because if you do well in the private side, as you all know, I think most people here are from the private side. As you know, if you're working hard, then your increment can be quite big if you work very hard in private sector, as opposed to the government side, where it's a little
mm,
bit more structured, and almost no matter what you do, you get the same increment. Oh, let's say that. And the other thing, yeah, like the other thing
yes.
you might have to consider about the salary cut when you move industry, because you don't have experience. So therefore, especially now when there are a lot of people looking for a job, and you might get 70-80 people applying for one vacancy, so you might have to consider the pay cut. And I have had this discussion with some people. I said, if I don't know what your personal circumstances, that's what I said. But if you cannot afford to take a pay cut, obviously people have kids and all that, then you know whether you have enough or not with less
Yeah.
salary. And career progression is also very important. I have in the past, I decided to take redundancy. A long story, but basically what I was offered was not so much of a career progression in terms of what they were able to offer me in the restructuring, and therefore I opted for the redundancy. And after that, got a better job straight away. Yeah. Again, you have to think about what's your
Mm,
career progression. Everyone has different speed in terms of what they want in terms of career progression. Some people super ambitious, one fast. Some people a little bit more chill and can hold on a little bit longer. So again, I cannot comment individual circumstances, because only you can decide about the salary career progression, how fast you want that to be. Yeah. And then once you've done your pros and cons, then just be brave and take the plunge when you think the new career is better than the old career. Yeah. I don't have any other magic
yeah.
wand for
So,
that, I'm afraid.
yeah, I did some transition though,
Okay.
when I did some transition, when I did the non-clinical, on the sideline on the weekend, I still continue my clinical, practice, for a while, because I
Uh-huh.
am still not sure. So I do not want to drop it, 100%. So I still do a bit of sideline of, evening clinics, and also some of the weekends and all. So for a
Right.
while, yeah.
Okay.
That
I
also
think
to top
the
up some
read.
income, to top up some income too.
Yeah, somehow make it work, right? So
Yeah,
there's a
somehow you make
couple
it work.
of
Yeah.
comments here. So Faiz asked, what is my turning point? I think I answered that earlier. And then Radha said, thank you to
Mm-hmm.
me for bringing her into the pharma industry. You're welcome. And then she also agreed with you, Abner,
Okay.
that pay cut can be seen as investment for our career progression. So thank you for that, Radha.
Yep.
Okay, next one. And I put this specifically as transferable skill as a doctor. And the reason I put this question is for everyone to think about what skill you have that you can bring to your next career. So whether you're a pharmacist now, a doctor now, or just now we have an engineer as well, then what are the skills you have that you can bring into your next career? And sometimes we underestimate ourselves, and therefore we don't know how to sell in the CV and also during the interview. Actually, we all have many, many skills. Yeah. You just need to focus a little
Yep.
bit and think, okay, these are what I want to highlight during the CV interview and all that. So I'll ask Ebner, what does he think are the key transferable skill doctor has that is useful for the corporate world?
Yeah. I mean, from this discussion, I'm a very, very analytical person, and I'm a very systematically organized person. So I think, so I mean, doctors are trained that way. Unconsciously we are born to be, or rather that we are trained to be a leader. Take responsibility. When a patient is in acute care, or a patient is collapsing and all, we are somehow trained to be a leader, to take charge. So I think that is something that whether it's a skill or not, it could be a quality, in terms of a character quality. But I think more importantly is that our train of thoughts are very systematic. For me, I'm a very systematical kind of approach to problems. When I see this problem, so I need to run through a few standard questions that I have in my mind, and then before I dig into some of this. So I think these are some of the key very transferable skills that as a doctor. And I think the other thing is people skill. Doctors has this good, I don't know, I suppose that most of the doctors has this skill, talking to people, and I think being empathy, also very important, because if you're able to empathize the person who are talking to you, especially in bad circumstances, that is also very helpful, especially if let's say you're a team leader, and bad things happen. So how do you actually approach to this issue, right? I think that actually makes us a leader, rather than having the entire know-how. I mean, having the know-how is important, but you do not need to know every single thing. But I think it's how to get the team united and to move forward. I think that is even more important, as in to give good direction, and also to be able to think and, overall, as a team, rather as a very individualistic perspective. And yeah, I think that's really make up the quality of being a leader. So if you ask me, I mean, these are some of the things that at least it's something that is very convincing. And I see most of my friends, they are doctors, they are in non-clinical, they all have the same characteristic. I don't know
Yeah.
if you notice those characteristic among your doctor's friend, they are non-clinical.
Yeah, and the communication I want to add is the listening, right? We have to listen to
Yep.
patient very attentively, every single word they say, because we're
Mm-hmm.
trying to figure out what's wrong with them and looking for the clues during the conversation. So for me, I think that's one of the major skill I have, listening. And when I think back, where did I learn how to
Mm-hmm.
listen? It was probably during that time when you have to really pay attention what the patients are saying. When did they get the chest pain? How long did it last? And all that kind of stuff. Yeah. And then the other one
Yep.
that
Yep.
for me has been super helpful is being under stress. That in hospital, you are, as you
Yeah.
know, very stressful. You have the cardiac arrest, and you have to really function
Mm.
even under the stress. And for me, that really carried me
Mm.
forward in the corporate side as well. So I don't get stressed too much because most of the time no one is dying. So therefore, I'm not that stressed. Unless being
That's a
very
very good one.
right, cardiac
That's a
arrest,
very good
someone
one.
is
Yeah.
in front of you, you're trying to resuscitate, that is stress. So everything else in comparison, I can handle it. It's not bad.
Yeah. Yeah. I mean,
Okay.
sometimes people would say, "Eh, why are you not stressful?" I said, I don't think it's up to that stressful point, that you got to be so worked up, just chill, relax, and
Yeah.
enjoy what's coming, yeah,
Yeah, yeah.
yeah.
Stress is when
Communication
you're what?
important.
Stress when you're half asleep at 2 a.m. The cardiac arrest call comes in and you have to run to wherever
Yeah,
the ward is that you've never been before and do the cardiac arrest. That's stress.
yeah, true,
Excellent.
true.
We got another question from Faiz. So since now it is quite
Hmm.
competitive, what is your advice so that we can shine out more than others? So what's your tip, Abner, to Faiz? Faiz, are you a
um
doctor?
yeah.
Yes, Faiz? Not sure. Yes, Faiz is a doctor. Yes.
What? Oh, yes. Okay. I
Yes.
have some delay here. Okay. Yeah, I know now it's quite competitive, really, to really stand out or shine more than the others, I think, besides having, you know, I mean, as if we graduate as a doctor, we assume that you are good at your clinical knowledge. So I think that's a core, a very core basic, right? So if you ask me, compares, you know, I think being able to, well, again, I think I still go back to communication. If you ask me, how do you outshine others, it's really about how you position yourself, when to talk, when is the right time to engage a good conversation, when to bring up a good point, or even give your good perspective, towards thing. For example, let's say, the other thing is also being sensitive to the, to question, to people, environment. It's very difficult to describe in words, how do you able, but you got to be so sensitive, agile, and when things happen, or when no, I don't know. You have a words to describe it or not, it's basically being, you know you're able to understand what the person need, right from the beginning, and well, getting paper qualification, I think, is also another thing, a point, how to stand out. For example, you want to sit for some exams and all. I think this is useful for your CV, whereby when people look at your CV, oh, you have this, you have that. So it's very knowledge based and very educational based. But you need to have a good CV so that people will call you in for an interview. So I think that is the first stage that you need to go through. And then the second stage is when you talk to the interviewer. And I think this is the time that you go to able to present yourself and to send the message across, so that the interviewer will be understand what you want, what you need, and what's your passion. And they need to feel that confident in you, so that you need to confident about yourself, and also you have the passion. Why do you think that that person should hire you as, as their employee, for example, or why should you get even be promoted? So I think we need to be bold enough to speak up, and yeah, I think, that's my
Mhm.
take. I don't know, what about you, Dr. Azza? What do you think?
Yeah, I agree. You need to, first of all, it's hard to give comment not knowing what your interests are. But I would say I would give an example. So let's say you are interested in coming into pharma industry. Therefore, you need to know who are your competitors applying for the same job. So it will be other doctors, there will be other pharmacists. Those two are the main ones who want to come into pharmaceutical industry. There could be some biotech and all that as well. but not so frequent. So your main ones are the doctors and the pharmacists. So what you have to think about is, how am I going to be better than all these other doctors, all these other pharmacists? My advice is usually think about three things that are different that you want to highlight in your CV, and also when you get to the interview stage that you want to bring into the interview. Let's say you might have done an audit project in your hospital. So therefore, not everyone has done audit project, but it shows that you're interested in research. Audit is very simple. It's not true research in a way, but at least it shows you have an early interest already, and you're start making effort. You're done some data analysis, simple data analysis, to just show that you have an interest. And then you might even someone before really came to me, and she brought to me her newsletter. So she was the newsletter, the editor for the hospital newsletter, and she showed me her work. And again, that's something different. You can just do that easily, volunteer to write the newsletter for your hospital, and you can bring that to the interview to show I'm interested to write. And MSL job is a lot about writing, presenting, and all that. So you can already show a little bit of your work beyond other doctors, beyond other pharmacists. And if you want to go into digital health, for example, then how can I be different to other people who are applying for this job? Can I start doing what Abner said just now, getting other specific qualification in digital health, learning how to do app or Python, or I have no idea. I'm just saying what the things I've seen related to digital health. So all that you can already start thinking. So it depends where you want to go, depends on the area, and start thinking, how do I want to be different compared to the other people applying? So you need to know who your competitors are. So if you cannot think of why you are different, then me, the interviewer, will also cannot see what's the difference in you, what's the advantage in you, and then will not hire you. So you have to think about your end and visualize the end and work backwards in a way.
Okay. I mean, I would like to echo on this as well. I think because I think Dr. Azza is looking for on the pharma side, and myself here, I've been managing hospital for quite a number of years, and I see that many doctors, they wanted to come into the hospital management. So the first thing they do is they take an MBA first, and then then they say, oh, I come in. Well, there's no right or wrong. You can try doing that, or even without, it is also fine. I think, one of the thing is that the attitude, when during the interview, and really to show yourself that what is the, additional soft touch that you have, especially us, people like us in the hospital management, because a lot of time is all about people. If you work in the hospital, we don't do much of research, but we do a lot of people management, and we deal a lot with financial numbers, and also business strategy in terms of how do you think, how do you actually so-called, because we are private hospital, so we are a organization for profit. So we need to make money. So we need to think a bit deeper on sometimes the position of for example, we give you a case scenario, so that actually can we were able to understand you a bit more. So usually, if I were to interview a doctor for any position in the hospital, I'll give them a short case scenario, and then from there, I will be able to know whether are they sensitive to the change of the environment, to the demand of the market or not. So this gives me a good feel or sense that whether this person is ready or suitable or not.
Okay, thank you, Abner. So we have a follow-up question from Faiz. So throughout your journey, what do you look for in candidates? So it's kind of along the line what we answered just now. Would you rather have a friendly and talkative person during the interview? So would you rather have a friendly and talkative person during the interview session? So maybe you first, Abner.
For me, I think that he can be talkative, but he must able to talk sense, and the points must be valid enough. So that's my only take. He can be friendly or whatsoever, I don't mind, but because during an interview, I
no
think
substance tak boleh juga.
Cannot. You must. So that's why usually I use a short case scenario. So sometimes to someone more junior sometimes can be quite difficult because sometimes I use some real case scenario. I said, what do you do, if this comes, and etc. So yeah, I need some. I'm I don't know about you. What about you? Do you need
Yeah,
someone?
yeah. Well, the three things, if I have to summarize what I look for during an interview, one, not for me, communication skill. We talk about this a lot already. Second one is about your
Yep.
competency. So this is what Abner said by case study and all that. I don't really use case study, so it depends on different interviewer. But at the same time, during an interview, I'm
Mm,
trying to assess how competent you are would be in
mm,
the new role. And then the third part is about the character. And character is very subjective, so it
mm.
depends on what
Yep.
how we connect that day. Yeah? And again, depends on what I need in my team also. If I have a lot of people who are introvert in my team at the moment, then I might be looking for someone
Mm,
extrovert to just liven up my team a little bit, and vice versa. If I have a lot of intro
yep.
extrovert already, then I cannot tahan another one. Bising sangat, then I might be looking for an introvert the next time. Yeah. So again, it depends.
Yeah.
Character is a very subjective stuff, and depends on my team composition at that time. Yeah. So the three things I look for during
Yep.
interview: communication, competencies, and then your character. Okay. So the next question,
Agree.
Abner, what the networking?
Yep.
How much networking do you do, and how
Huh.
much do you think it contribute you to your success in moving from different job to different job?
Oh, this is, oh. I mean, as a hospital administrator, I think networking is very important. Because we look at the very macroeconomic and the micro side of it, because we need to be sensitive to the changes to the market. You need to know the demand of the market, and you need to know your competitor too. So without networking, you're not able to be sensitive, to the price, to the change of the whole the people's behavior. So I think networking is very important, and I do quite a bit of networking actually. I meet a lot of people from time to time, because by having different meeting different people, that gives me a sense of different exposure, different perspective, and sometimes talking to them alone, helps me in terms of my decision making. Just like just now we had some conversation. I'm having some roadblocks in terms of what I'm going to do next. So I will just bounce some idea or throw out some question and then see whether if you respond to it or not. Then if you respond to it, then we can dig a bit deeper. And I think the other thing about networking is that the uniqueness of you get connected with people emotionally. So sometimes you do not know whether opportunity comes just like that. Sometimes when you meet people, when they need your help or not. So I think networking, if you were to define it, there's really no specific definition. But I do enjoy networking with people, and I think that's very important because you know if you meet different level of people, you're able to share their experiences, and I think you're able to innovate along the way, and it does help in terms of my productivity. And in fact, it is also one of the very important bargaining chip, um, for myself. Like for example, now I moved from the hospital side to the insurance side. I have a very strong bargaining chip simply because I'm the insider for the hospital side now. I know their costing, I have the resources, and when this insurance people they want to deal with hospital, I'm the right person. I'm the key person that I can connect with all these top leaders, the top management, and I can get the contract signed just like that, because you prior to that you have their trust, they know you,
Yeah.
So I think once you build some confidence in them and they know you, I think it's easy. For example, right now, we are networking as well. If I need some help, I say, hey, Dr. Azhar, if you have some friends in this, you can get me connected, right? So that's helped me a lot,
Definitely.
yeah. So
Yeah.
I think LinkedIn is also one of the very good platform for networking too, not just offline, but online too,
Yeah.
sometimes you do not know and we met online, our first chat, and that's how we get
That's
connected.
right.
So this is where magic that's where magic happens, right? So
You have to put
and
in
I
the
think
effort
during the
in,
networking,
right? Yeah.
yeah, and I think during networking, I think the other one is open your heart. I think during networking, um being too arrogant or too egoistic is not good. You got to be humble while networking, sharing our experiences. I think
Mhm.
these are some of the we do, and I enjoy doing that too. Yeah.
Okay. Thank you, Ebner. I think on the subject of being arrogant and all that, maybe I'll go to the question from Travis. So Travis asks, how do we not cross the fine line between being helpful or being too aggressive as a new recruit working within a team? What do you think, Ebner?
Mm.
Good question. Travis from my team, by the
Oh, I see. That's why you don't answer this, huh?
way. I'll answer on it.
Yeah. Okay. So yeah, I'll take this question. If you were to ask me, so when we want to be helpful or to be aggressive, first of all, I think first you need to know your team. I think first you must know who are you dealing with. You must know your team, what's their character, if possible, and also their agenda or their motive to do something. For example, now they wanted to do this project simply because they want to be seen or they want to get promoted. Then don't to be too helpful. You don't need to be too helpful. You just got to be patient. When they need help, you said, if you need help, I'm always here. Not to be. So I think this is a very soft part of how do you gauge when you want to go in to help or when you should be patient and look and see. So I think it really depends on that situation. Let's say a patient is dying, for example. Let's say a senior doctor is there resuscitating. Would you jump in and help as an intern or not to resuscitate as well, or will you be there standing waiting for him to tell you what to do next? It's a similar, right? So or at that point you are in a public place, a patient collapse, you are a doctor, whether you are intern or not, you definitely first to go in because you know that this is you are a doctor, so you will respond to this, as your first responder. So I really think it depends on situation. Yeah.
Yeah, I would agree with that. It depends on how we approach it as well. Because I don't know the situation, Travis. What is the tone when we're
Mm.
offering our help? And again, is it something that somebody has working for a long time, for example? If somebody has been working on project for similar to what Abner said, in a way, this person has been working, let's say 2 3 months already, and suddenly we come in with a new idea, trying to change stuff. Maybe it won't be taken
Yep.
so well. Our intention to help, so therefore, has to be quite sensitive to people's reaction and understand exactly
Mm-hmm.
what I'm gonna say, where they are coming from. Yeah, so that it's a tough one. It's again more about people management, about understanding body language and all that, and making sure that we are picking up the signals that people send to us. The next question from Radha. Wow, as if Radha knows what my next question here as well. Yeah. So what are the things that you need to do when you first join a company? Yeah. Radha read our mind. She knows what you're gonna discuss
Yes.
this. She's reminding us to discuss it. So I put that as the first 100 days. What do we need to do? Can we just lepak
When I
lepak
saw
for
this word
100 days?
100 days,
Some
the
people
first
90
thing
days, some
when I
people
saw
say
this
100
question,
days.
100 days was like when the first time the opposition won as the government, that time they say, what's the achievement?
What's
The
the
first
achievement,
100
right?
days in
And they
power.
go, alamak,
Yeah.
nothing.
Alamak. Yeah, I mean, from my perspective, because I do not know your circumstances, if were to put in my perspective, is that as a quite a senior management in hospital, I think understanding the organization chart is very important, the structure, whereby the function of the people, the relationship, and also to identify the gaps in the organization, because you join in as a new person. So basically, you start new, you start fresh. So what you bring forth is a new, fresh pair of eyes. I think this is also very important. Whether you are intern or senior management, or even middle management, as a manager and so on. I think able to identify gaps, and depending on your capacity, if you think that you're in a capacity to formulate a quick win strategy, for the organization, or even a medium goal, to the senior leadership, I think that would be very important. At the same time, taking into consideration that you are able to pick up the quick relationship among different teams, you see. Unfortunately, if you're working long enough in large organization, politics, office politics is one of the very key reason of people leaving the office, or even why an organization could fail, not missing their target and objective, not just a pure business, but also internally. I think it is very important that we are able to quickly identify the gaps. So if, let's say, you are in a very junior position, then speak to your immediate supervisor or manager. What do you see, and what do you observe? I think the key here is good communication and feedback. So what I usually do, even in my first 100 days, or even the 101 days and above, is that I usually do summary of what have I done in this 1 week or 2 week, and I will do a written report to my immediate supervisor, and I
Oh,
usually break them
really?
down to category. Yeah, I do that. Even up to right now, I still do that to my reporting manager. Yeah.
Oh,
Yeah.
interesting.
So
I knew you're
yeah,
analytical.
yeah. And the fun part is that so usually I do weekly or bi-weekly, sorry, twice, once every 2 weeks. So sometimes in a year I can look back, during this date, what have I done and all. And I find that it is very helpful, because especially when you need to do your midterm and your year end performance review, right? Your what have you done and all. So for me, it just take a couple of minutes for me to really fill up the boxes, because I have all my things that I've done all in my that folder. So I don't even use words. I just use notepad. Only notepad. I just use a notepad, and I put down the date. What have I done? So I categorize them into different categories, and I fill up the blank. Just by word. In terms of growth and whatsoever, and my focus. So every time
Mhm.
during the review and all, I find it very, very helpful. I just review. I don't even need to recall what have I done. I just got to go back to the folder, click on the date that I wanted, then I have all the information. So
Yeah,
so
I like that a lot. I might start doing that. Yeah, because like this year, suddenly it's nearly October. I'm thinking, what have I done? So I
yeah,
like
what
that.
have
I
you
think
done? Yeah,
it's about being proactive on your side to acknowledge what you have
yeah,
achieved and make it easier to talk to the boss as well about the achievement. Yeah. And to add to that, I want to also agree about the quick wins. I think the first 100 days is actually very fast, and what you want to concentrate,
Yep,
especially if your new job is a managerial job, then you want to show your team what you can do. So that's where the quick wins come in. At the same time, it's not about trying to change too much in the 100 days because you're new. You're still trying to learn actually. And I've done some
agree.
mistakes in the past. I'm a driver, so I like to do things fast. And there has been in my transition before where when I look back, okay, maybe I should have slowed down a little bit in making some changes. But yeah, so I've learned
Yep,
that through experience. Okay, 100 days, no need to do anything
I learned that
drastic,
too.
right? Yeah, so 100
Same
days
mistake, same
really
mistake. I
just
did the same mistake.
yes, so learning from both our mistake. First 100 of days is really about observing, understanding what the work culture, work relationship. You're looking for the quick wins without making too much disruption. Yeah. People also want to see that you can perform, you can deliver. Therefore, you need to start thinking, what can I
Yeah,
do within the 100 days? So similar to the politics, yeah. So people look at the 100 days, what do they do? Nothing. And then 600 days also not looking great. So
yeah,
therefore, yeah, need to
yeah,
start thinking what are your quick wins that you can show to people around you.
yeah,
Okay. So we
yeah. The
actually
other thing about the 100 day, just
yeah.
add on one more point, is that
Mhm.
also to set your expectation. I think always we look into what the bosses want. Sometimes we also need to manage upwards, and I think this is what I do a lot of time, because I have many bosses. So you need to look into how do you manage upwards. So setting your expectation so that they also need to know what you want to achieve. So you need to set your tone, you need to set what you want. Well, this is again, different people have different style. For me is that I will I will set my goal, my direction, and I will sometimes will sit my bosses down and tell them, look, this is what I wanted to do, and how I want to do, and I will give them some of my my expectation and all. So but try to do it in a soft way. Don't do it too hard. uh, uh but I will do it. It just my style is like that. So I will tell them, okay, this is what I want to achieve. This is the in the next couple of what months or so, and I find this is the gap and what I wanted to do. I will tell them a very a bigger framework, or a far vision. Then slowly I will bring them down to break them down to what I want to do, in a very single jigsaw or a puzzle, bit by bit. Then eventually, at least they got the first concept right from the beginning. So then eventually when I do, then I actually laid off the whole that the picture that I wanted to build. So that's me. Yeah.
Awesome, awesome. Thank you very much, Abner. I think we are already out of time. It is already 9:36. So thank you everyone for staying with us. There is still two more questions from Faiz and Wahida. So if you can just send the question to me later on, just direct message me and I'll see what I can do to help with your answers. Yeah. Your questions, I mean,
Yeah.
we'll try to answer that later on. Um, we don't have time to discuss this, Abner. And at the end, just some feedback from you.
Mm-hmm.
So if you can just write in the chat how you felt about tonight, it would be great for us to read that. And then from my side, if you want to follow me on TikTok as well, I have a TikTok channel where I am discussing about my career tips. And also I put my CrossFit videos in case you want to know what CrossFit is, some encouragement to stay healthy from a doctor. And then I also write a
Okay.
longer piece, a newsletter where I call Career Autobahn. And I choose Autobahn because Autobahn has no speed limit, right? So your career is like that too. There is no speed limit to your career. Up to you how fast you want to go and where you want to go. And then if you want to get connected with Dr. Ebner, who already received top healthcare management voice there. Wow. From LinkedIn award tu. Jangan main-main. That is his QR code to his LinkedIn profiles. So I want to say thank you everybody for tonight. Thank you for your question because it set us off on another round of discussion to answer your question. I hope it's been really helpful. And if you do have any more questions later on, you can send it to me. You can also send directly to Dr. Ebner, and we try our best to help you answer and guide you towards a better career. So thank you, everybody. Good night.
Thank you so much.
Right.
Thank you.
Thanks.
Thank you for the feedback. You read that, Abner?
I belum tulis. Actually, I wanted to talk a bit about the change of industry to insurance, you know.
Boleh, cakap lagi.
Tak sempat.
That's
Kena buat
that's
part
the
2
very
ni. See, I
no,
told you,
because
Abner, kena buat part 2 already.
because I was thinking, you know, I prepared some, you know, the key success that I wanted to share, you know, building a hospital from scratch, you know,
Wow.
this China opportunity, you know, how do I seize that opportunity?
Tell me when you're free. We'll do it again. I'm
I'll tell you a
sure
bit more.
many will still attend again to hear specific stories about hospital management and China.
Yeah, you know, I actually prepared a fair bit on very specific example on some of the hospital management. You know, if you would like to have some insight on, you know, how do you actually run a hospital as a whole, you know, it's actually quite interesting to see how do we run a profit for organization for profit company, you know. Because sometimes patients were thinking, you know, we run private hospital, you guys have commercial team and all. I say, yeah, we because we are here for profit.
Yeah, lah. At the end of the day, it's business, kan?
Yes. So I don't know. I think many of you would like to explore to hospital management, right?
Yeah.
Yeah, we have to do another one specific for hospital management. Right, Wahida,
Yeah,
I'm going to
because
remove you,
Yeah.
yeah? Okay,
Yeah,
bye-bye.
true. Okay, bye.
Okay,
so
awesome.
yeah, okay. Yeah. Actually, I did prepare a text. You know, if you want, I can send it to you, or even maybe I can do some LinkedIn posts on some of the text.